All right. Well, welcome everyone to the whatever time of day you are, Wednesday session or sometimes Thursday morning if you're in New Zealand, as it turns out. Today we will have a couple of, this afternoon in my time, we will have a couple of sessions. First, we will have three members of the ISAG Independent Science Advocacy Group in Ireland. Then we will have two members of the policy/team in New Zealand. So I will start by introducing Tomás, Aoife, and Anthony. Tomás, and each of them are academics with incredible academic records. Anthony is in public health and epidemiology, including spatial epidemiology, which is a favorite topic for me. And Aoife is involved in molecular evolution, and Tomás is involved in memory in the brain. I'm not going to spend a lot of time talking about their usual academic records. Today, they will, of course, be focused on COVID and the challenges really of communication. We have found that the important thing in a pandemic is clear understanding and communication of science, but especially how it engages with adoption of those ideas and its policy implications. And in Ireland, I've been had the honor and pleasure of participating in the ISAG group and witnessing the amazing efforts that they've made to shift the conversation there from the living with it to the zero COVID elimination strategy. And there have been tremendous battle. I sometimes think of it like, I don't know, French musketeers, amazing sword fight going on TV, radio, and in the newspapers. In any case, I would like to start by introducing Tomás. I've asked the group as a matter of strategy to help us both with modeling the communication. So what is the communication? And how that communication works. I don't know if everyone is going to do that, but I surely wouldn't mind if each of them takes a few minutes to just share example, to model for us the communication, and then also to talk about the challenges around adoption, and of course, other things that everyone should know who would like to engage in such an effort in other locations. Tomás, please.
Well, thank you, Yaneer, for the invitation to join this event. And of course, for all of your extremely useful help in the ISAG group and engaging on COVID-19 in Ireland. I think this is still a work in progress. And so, I would probably be speaking more freely about this in a year's time, I hope, when this is a purely retrospective analysis of what's happening. We are right in play at the moment in Ireland. I think this is our last opportunity to get the pandemic right, and a lot is going to be decided over the next few weeks. And so I'm conscious of this. I'm also conscious of the fact that we haven't actually succeeded yet in what we're trying to do. And so therefore, you don't have to take what we're saying to be all the right things. However, we have, I think, learned an awful lot about the kinds of things that work and the kind of things that don't work, and how to interpret what's going on in a way that can make you useful. I think Yaneer made the central point, which is that this is about communication. And much of what has been going on in many countries has been about science communication to the population. The exception is maybe places like New Zealand and South Korea, that one way or another got it right at the beginning. And in those cases, it wasn't necessarily about science communication to the population. It would have been about science communication to the government, and that the government very early on would have made the right scientifically informed decisions. And by that mechanism, gotten public confidence on board, particularly when they delivered such good results relative to the rest of the world. I think for every other country that didn't get it right initially, science communication is everything, because it's the only way that you can expect the public to be motivated to change the government position and to put pressure on the government to alter its own policy. We, the ISAG group, we're made up of about 15 academic scientists, plus some academics from the humanities, from social sciences, and a lot of very helpful and growing numbers of support people, without which we wouldn't be able to function and we would be much less effective. And it started out as a very small group of us working individually. I suppose one of them, Anthony Staines, who's here also, was as an individual engaging in public communication of science from the beginning of the pandemic in Ireland. And we, at that point in March, we were all in panic mode and no one really knew what was happening. And then you got to the moment where everyone realized there was going to be not one wave, but 7 waves before you get to herd immunity, and that was not, something that we wanted to stomach. And so strategy became everything. And what was alarming to many of us was that there was no strategy from government. There was no testing strategy. There was no long-term, how are we opening up, when are we closing down? And you could there was a moment I remember for myself in March where you could see exactly how 2020 was going to play out. And for me, I was sitting in a particular pub in Dublin one evening reading Tomás Puyo's piece, Why You Must Act Now. And I was immediately integrating that with everything I knew about my own country and how it worked. And I could exactly see what the problem was going to be. And then in my own part, I agitated to try and see what I could do to help. I ended up being on a testing task force that was meant to advise government on how to set up a testing strategy that would help to suppress things. This is before I thought elimination was possible, or that we knew elimination could be possible. And that didn't work out. And then you find yourself quickly in a situation where you see that there are gaps in the government knowledge, and you see that there are gaps in the public knowledge, and you get all the information together, you research the topic, and you write an op-ed, and you get that op-ed out there, and you explain to everyone, this is how we need to do it. And you think that's done, right? I can go back just to not thinking about this because everyone's going to be aware of this, and this is going to catch on. And of course, that's not how it works at all in the real world. So since then, I've personally written over 20 op-eds and have made more media appearances than I can count, because it's all about persistency with message. You've got to be constantly saying, not the same thing, but you have to, getting the core messages across to people takes a very long time. And there's an awful lot to learn here from climate science and what climate scientists have had to be doing for years now to engage with the media, to engage with government, to engage with public perception for how you can change understanding for what's actually going on. Anyway, about May, we found each other because we're all in different fields. So we don't normally work each other. When we formed the ISAG group, which has been slowly building since then, we have exceeded our expectations in some ways in terms of visibility and contribution to the conversation. But we've completely failed so far in having a meaningful impact on policy. I mean, I like to think there's a few things that we've had an impact on. I would say those are, as a result of public engagement. One of those things is that when we had our second wave in Europe, we locked down pretty early and we saved a lot of lives in the second wave as a country. And I think that's because we were partly reinforcing what the official public health advisory team was saying. The other thing is that when making our own case for elimination in the conversation, we've had to put out frameworks for thinking about COVID-19 through the media gradually. And though people disagreed with us for a long time, because back in last summer, people didn't think there was going to be a second wave. People back then had the mentality, maybe if we socially distance and wash our hands, there won't be a second wave. But through that period, the public and the media gradually started to adopt the frameworks that we were using to think about things. Even if they weren't agreeing with what we were saying, they were talking using our language. And probably the single most visible output was when we started to introduce green zone strategies, because we wanted to achieve elimination without a global lockdown when we were in low cases in summer. And we adopted the green zone strategy with the help of Yaneer. And we proposed a color-coded system for different counties in Ireland, and we described how this might work. And the government then developed a framework that was very, very similar to that, not long afterwards. Unfortunately, they didn't develop a strategy for how we would get to level 1, which is the best stage in our framework. They swapped colors for numbers. So that was lacking. But other than those things, I don't think we've had a significant effect on policy yet at all in the pandemic in Ireland. We have had a significant effect on the conversation. We have had a significant effect on public understanding of science. And we're constantly given a seat at the table by the media whenever anything is happening. Now, that doesn't mean the media is always representing us properly. Unfortunately, though we've always been included, we have been presented for a long time as the extreme end of the Overton window. The other extreme end of the Overton window being literally herd immunity people and denialist people. And this was a problem. And it was a problem for a long time. And we made a lot of tactical and strategic errors throughout the campaign because of our own naivety on how to deal with things. And I wouldn't say that we're completely naive. Many of us have been involved in single issue campaigns in the past. I mean, we're the kinds of scientists that chose to get involved in this. And some of us, such as Professor Anthony Staines, has been heavily involved in political life in Ireland for a long time. But I suspect we were slightly naive about how long of a journey that this was going to be. And if we had known that it was going to be so long of a journey, we should have organized ourselves like any activist group should have organized itself on any issue from the beginning, and that it can't just be a handful of knowledgeable voices getting into gladiatorial debates in the media. That only goes so far. And it can't be just about showing people that you're right. You have to win their support. You have to win their motivation. And you have to have a very pragmatic, hard-nosed communication campaign that is well organized, that's run like an advertising campaign. You have to have all these things in a very regular way. And the way you can do that, of course, is you can't do that on your own. You need help to do that. And there are lots of people in any country that are there willing to do this for free, voluntarily, really good people. And it's about finding those people and getting a group together and making that work. Getting people who know how, they won't be scientists and they don't need to be scientists, but that know how to put these kind of movements together in a sensible way. And you also have to have caution for all of the risks that you have in those kind of movements. You have to be careful about extremists. You have to be careful about people who aren't really going to be saying things the way you want to be saying them, and so on. But one really interesting point for us in the story was when we started to become more aware of public opinion. And for a long time, we were in the dark about what the public in Ireland really thought about COVID-19. You know, everybody wants to be zero COVID in concept. But for some people, that means they want to go back to 2019 and pretend the virus isn't there. And that's different for different people. And there was then some polls that were done by a very competent statistician and pollster who works in the UK and Ireland. And he identified 4 different groups of voters in Ireland. And he got into how did they form their opinions on COVID-19 and how we should manage it. And this really changed how I viewed how we needed to engage with the conversation. And what we found was that what he found was that there were 4 different constituencies. One were the zero COVID people who were explicitly for eliminating the virus from Ireland. And they made up about 30 to 35% of the population. And then you had this government group, which were the centrists. These were the people who are going to do whatever the government said and said that's going to be the sensible thing to do. But really, they actually supported the medical advisor to the government more than the government. And they, from the beginning, wanted travel restrictions, which is what our chief medical advisor wanted. And the things that they wanted, though they didn't identify as zero COVID, they wanted a lot of the things that were necessary for elimination, but which the people weren't doing. And then there was this third group, which was 20%, maybe 20% of the group, which were to just open up for the economy. You know, we need to put the economy before health, which was an honestly held opinion, well-meaning even opinion by people who are just not informed about how the virus works. And then you have the 10% of people who are the denialists or the really hardcore herd immunity people. Now, the problem is that though we constantly had visibility in the media, because we had some good communicators in the team and because we put a lot of effort into it, and because the media formed relationships with us very quickly, was that we were constantly put against extremists, against the fourth constituency. So they would platform us against the two extremes for perceived media balance. The way they would do it was very interesting. They knew they couldn't platform the Irish denialists because these people are also anti-vax people and they overlap with a lot of other things that they were not going to be seen to promote. So what they did was they would zoom in the famous denialists from the USA and from the UK. They would zoom in people like Gupta and people like Hennigan and so on, and the equivalent names in the USA. And then they would have a person from the third group, a person from Ireland on the Open Up for the Economy group. And they would create the illusion that that coalition was essentially representing the government view and that we were going to have to open up anyway. So this is the way things were going, and that we were the other kind of extreme. And then it was almost as though the Open for the Economy group was the sensible middle ground between herd immunity and zero COVID. The government view, which was essentially which was hopeful suppression, really amounting to rolling lockdowns, the government view was never challenged. The government view was left sit there in the background while we were faced arguing with an extreme view. And it only became apparent to us very late in the day that the media all the way through this thought that we were extreme, that the media who were platforming us against the herd immunity people did actually think that we were of the same kind of lacking realism, that most of the media did not want to go for herd immunity, but they didn't think we were what they wanted to go for either. Then we started to become aware of what the population thought. And then we started to move into Christmas around the same time. And this is where things really, the wheels came off the wagon in Ireland. So we did everything we could to try and not open up at Christmas. We opened up at about 250 to 300 cases a day for the Christmas season. We opened up hospitality, and 2 weeks later, everyone started mixing in houses. And we had the highest cases of COVID-19 in the world. And it wasn't due to the new British variant. The British variant was only 10% of the virus population by the time this had already gotten out of hand. And nothing was done to mitigate against this. And it was in the realm of what was predicted to be possible, but it was in the upper extreme of what was predicted to be possible before we opened up. We're still recovering from this. We'll probably have about 1,000 deaths in January, and that's will be a third of the overall death toll in the Republic of Ireland. And now we're in a very long third lockdown as a result. We still don't have any kind of a strategy. There's a lot of confusion at the moment about vaccines and so on. But the polling has changed. And what's happened in the past couple of weeks is that we've learned that 90% of Irish people want mandatory hotel quarantine for everyone coming into the country. Over 50% of Irish people want all flights to be banned from any countries categorized as red by the European Centre for Disease Control. It's the same in Britain. 87% of British people want mandatory hotel quarantine for all countries. 65% of British people want to ban all flights from all countries that would be coming into Britain right now. Most people in Ireland and Northern Ireland want an all-island strategy, all-island cooperation. And in all polls that have been done in the past week, none of them are definitive, but people want a zero COVID strategy. One national poll on Monday night on the national broadcaster's main TV talk show, over 70% of people wanted a one long lockdown to end it all, and even were willing to close the border, which was quite surprising, which incidentally we're not advocating for, but we are advocating for managing the border with Northern Ireland. Today I was on a radio show where in County Wexford, where 98% of people want a zero COVID strategy. And this is a poll that was done over a week. It wasn't just done during the one radio show. And this is showing up all over the country at present. All of the 4 opposition parties in Ireland in the past few weeks have come out for zero COVID, and dissenters in all of the 3 political parties in the government are slowly coming out for a zero COVID strategy. So the government and the resistance has sort of moved away. We had a lot of resistance from lobby groups, and that has sort of dissolved. So in a way, it's been very encouraging. We're taken relatively seriously by the media and by the public, but it was only after everything was exhausted, after everything else was proven not to work, that people accepted this. And now there were 2 problems before. I'll pass on to Aoife and Anthony now, but there were 2 problems else about how things were happening that I would observe that you need to keep in mind when when trying to lobby for these issues. One was that the media would never pay attention to the successful countries. So they would always pay attention to unsuccessful countries, and interestingly would not learn from them. So when the US was in its second wave, or when other countries in Europe like Belgium and Spain were doing so badly, it was strange that we didn't think that would happen to us, but that the media, though we did pay attention to that, we didn't seem to learn from that. But almost no attention was paid to New Zealand, to Australia, to what was going on there, what was life like. The other thing is that to appreciate the influence that is really driving short-term decision-making for the government. Unless you're in an election year, it's not really, unfortunately, about voters in most places. It's about lobby groups and other special interest groups and unions. Unions, I've learned, are really slow to make up their mind about anything. So in a crisis situation, unions don't seem to be very agile, which I found to be very surprising, but it's the way it was. Whereas the lobby groups for commercial interests, whether it was hospitality, restaurants, airlines, whatever, they were very agile and they were very, very, very motivated to influence government decision-making. And you couple that with the fact that the government is surrounded by a subset of medical advisors who don't really represent the broad expertise of the scientific and medical community. And I really would not, this is something to be very careful about. The people working in the civil service in any country and the people who are surrounding government are going to be under immense pressure and stress. And they're going to be trying to maintain good relationships with the government. They're not going to be, therefore, behaving in the most direct manner. They're going to be choosing the words very carefully. And they're going to have the rest of the scientific community saying something different, perhaps. So, this has to be managed, this has to be respected. But it's also important to remember that a lot of the people that government, scientists, the physicians that governments surround themselves with are the people whose job that is under peacetime situations. And if you're involved in managing public health in most countries, you're not really dealing with the same kind of issues as you're dealing with under a pandemic. And part of the problem in understanding the variance in scientific advice is that the government don't necessarily understand this. They can't necessarily tell the difference between different specialties of scientists, and they also can't tell the difference between the experience level of different scientific individuals. And then there's the difference between what I would describe as the science of what we know and don't know, and the science of what we can do, what we can actually get done, which are two very different things. And I don't think that most governments have a good understanding of the difference between those. And so you end up with this mentality that politicians will come to, which is scientists should be on top, not on top. And, doctors differ, politicians decide. It's hard for most politicians to really understand why scientists differ and how to make decisions in the face of uncertainty. And I think a lot of public communication of science in a pandemic is about this. It's about understanding, look, this is the likely scenario that's going to happen. This is the worst case, best case. This is the stuff we know. This is the stuff we know we don't know. And it's very hard because most politicians will be motivated to use what we don't know as a way of making the easier, safer decisions in their mind, which is to open up and keep special interest groups at bay. And they don't have the confidence to face down those special interest groups and to say, no, look, it's better for you if we do it this way. You'll see. And they can't persuade these people of that. So they end up floundering in the middle, and this is the kind of situation that emerges. So it did seem, so if, going back to where the beginning of this, I think we've learned that a lot that we would do differently. I think the start is to get a group of scientists together who are willing to work on this. The second is to make sure that you have people who have domain expertise, and you want the people in your country who have the best domain expertise in it. In ISAG, we do have the people in Ireland who have the best domain expertise in the topic in epidemiology and infectious disease in our group. You also need good science communicators. You need people who are experienced in social activism. You need people who are experienced in communication strategies. And you need people who know how to engage with and talk to lobby groups and political parties and unions. And that is absolutely crucial. And we only have one or two members, one member who came on a few months ago, who's been absolutely fantastic at that. And we weren't all even aware of how to do that. But being able to not just appear in the media, not just talk to politicians on top, which when you got access to them, but to actually talk to people whose job it was to represent special interest groups and to think the way they do. And to do it in a non-oppositional manner, and to realize that when you're planting seeds with them, that they may go away and you think, have they forgotten about this? But it changes when the story changes and they come back to you. These are all different things that apply to absolutely any special interest, for want of a better term, social issue that you want to be advocating for, but just as much to this. And I think that just to close, I would say, the main thing that I learned was that science communication is something that is, I thought I had done a lot of science communication before I got into this. And by most standards I have, but science communication is something that is actually really underdeveloped in modern society. This is a serious issue for engaging on climate issues going forward. Because if we can't handle this, we definitely can't handle climate change. And that science communication is not the way that most of us as scientists are trained to do it. It's not about being entertaining. It's not about getting money or getting people to think your work is interesting. Science communication is a subset of communication, and communication is 50% about listening. And if you're not listening, you're not going to persuade anyone at any level, from a citizen to a politician or anything in between. You're not going to persuade them if you're not actually listening to their concerns, understanding their concerns, empathizing with their concerns, and then incorporating those into your own messaging.
you, Tomás. Do we want to take questions now, a couple of questions, or do we want to have the other presenters first? I see someone has hands raised. Why don't we get the questions typed into the chat for now? And let me just take a couple of questions from the chat. One question is, why does the government not trust the experts when the public is inclined to listen to the experts? Bureaucracy must be strongly scientific. Do you want to try to answer that, Tomás?
I don't know if you've ever seen the British comedy show In the Thick of It, but you know, the attitude that a lot of politicians will have is, you know, ask the right expert. You can always find the expert to say what you want to say, and that's what a lot of politicians will do. I spoke to the current Prime Minister of Ireland once before he became Prime Minister on the phone, based on one of my newspaper writings, and he wanted to figure out a couple of things. And he was very surprised to hear that I thought there was going to be a second wave. And I was very surprised that he didn't think there was going to be a second wave. And I tried to explain to him why it would be extremely unlikely for there not to be a second wave. And I thought I did a good job, but then he went and called another scientist who told him, well, you know, maybe, maybe not, and gave him a very optimistic view of things. So politicians, good ones, are very good at listening. I mean, they wouldn't get to where they are if they weren't good at engaging with people and listening to what they think. But that doesn't mean they're very good at evaluating discrepancies and figuring out what is the best thing to do. So I think that's part of the problem. And a lot of this is very similar, I think, psychologically, just to add to, as well as that, to the 2007-2008 crash, which was very visible. It was coming at us, you know, not like this. It was not, you know, a black swan event. It was a rhinoceros that was on its way, and we could see it coming. The data is there, the facts are there, but you have to be willing to look at it. And people, including politicians, are wired to think that these high impact events, just because they're high impact, are also low probability, because most high impact events are low probability. But when you know that a high impact event is not is actually high probability, then you need to consciously change how you look at that. And I mean, that's what happened in New Zealand. That's what happened to a certain extent in Australia. Of course, in South Korea, they had a pre-prepared schema for how to react to this situation. I think every country makes its own mistakes in its own way. But in Ireland, nobody wants to make a difficult decision. So the easiest decision to make is none. And that's what happened in between the first and second wave.
All right. So thank you, Tomás, according to schedule, Aoife, you are next, please.
Thank you. Okay, so I mentioned to Yaneer I have a slightly glitchy internet today. There's nothing I can do about it, so I hope it stays smooth for this. But thank you, Yaneer, for the invitation to talk. I should say, so Tomás and Anthony were founders of our group, and I'm a latecomer. I only joined in whatever it was, August, September, I can't remember exactly. And the reason I wasn't in it before, I suppose there was a few reasons. One was I thought we were going for zero COVID in Ireland in some respect. You know, we had this extraordinary lockdown. We got the numbers so low, and I thought, you know, well, this looks like we're trying to eliminate it from the country. I didn't understand that the government weren't following through on their part of the deal. You know, so that's one thing. And the other thing was, I didn't think I belonged in a group like this, because I'm an evolutionary geneticist. I'm not a public health doctor. I'm not an immunologist. The genetics part has become more useful as we're talking about the evolution of the various variants around the world and what's happening there. But at this time, we weren't thinking that way. And it was actually Tomás encouraged me to join the group because, you know, he said, well, you know, you can help with communication. You're a good communicator. And that felt like, it didn't feel like a very good useful contribution to the group at the time. You know, I was feeling like I was elbowing in on something that was an extraordinary project by other people, but I was actually really interested to be listening, so I joined anyway. And then it turned out, you know, I feel like I have made myself useful, and there are people in the group, I mean, like Tomás mentioned, who do extraordinary analysis. Like we have brilliant analysts who they're digging into the numbers, you know, making really brilliant predictions, but some of them don't enjoy talking in public. So I consider myself then a kind of a spokesperson, and I have quite a bit of experience in science communication before this. I've done lots of TV and radio and things like that, but it was always on my terms when I did it. You know, it was something I wanted to talk about, and talking about it in the way I wanted to talk about it. So when I first went on, you know, a primetime, nighttime politics show, and it was this really adversarial back and forth, that was quite a different experience. But I have the second thing, which I kind of, which is very common in Ireland, which is I like politics as a hobby. So I like, you know, I watch these shows a lot, and I'm always shouting at the radio with the politicians. So now they were in front of me in the room, so it wasn't a big difference in a certain way. But, you know, so this is something that I've been easing into then, but we have learned a few things that I think are translatable to other countries and to other situations. So I suppose there's a few things. One thing to mention is we're quite lucky in Ireland that there are really there are a certain number of radio programs and television programs that have a huge viewership. So you do know if you get onto those, you are reaching a huge number of people. So that's a huge advantage already. And we get invited onto those, luckily enough. But one thing that happened, one thing that we realized we had to do was the old trick that politicians do, that we complain about, which is answer the question you want to be asked, not the question you were asked. Because sometimes they might try to paint you into a corner on a minor point, distracting from what is the big point. So you know, we kind of talked early on about bringing it back to the point we want to make. You know, it's not this little detail. You know, the very first TV appearance I did, they had this little recorded video they showed before I came on. And there's this woman who's talking about her shoe shop that's been closed for, you know, months because of this thing. And the shoe shop is called Neville's Shoe Shop, and it's her husband Neville who died young. And it's this awful sob story. And, you know, they turn to me and they go, shouldn't Neville's shoe shop be allowed to open? Look at the lovely widow there who can't sell shoes. And, you know, it was, so I had to turn around and go, yes, Neville's shoe shop should open, and so should everything else. And the only way we get to that is if we do these things, right? So I had to, you know, think on my feet to not get dragged into the sob story of this poor widow with Neville's shoe shop. The other thing I think we realized was that we were the merchants of doom for a while, because we were trying to warn about what might happen. And we felt, I think, it was our responsibility to warn, but it was very, it was really hard listening. And people didn't like to listen to this, the terrible things that might happen and the deaths that might happen. And we were making people feel, I suppose, despair and not giving them anything good to think about. And so a little while ago, so Tomás mentioned, like, you know, this group has been growing, and what's really good is that people have been gravitating towards us. And in Ireland, in the last few years, only a few small, short years, we've had quite a lot of experience of big campaigns, political campaigns that came from grassroots. So we had a big campaign for marriage equality, and we had a big campaign for abortion rights. And so these came from grassroots. So in Ireland, we have a lot of people, me included, who got involved in these campaigns and learned for the first time what it is to try and campaign for a change in the country. And so some of these people who have this previous experience came to us, and they've been volunteering their talents. And one of the things that we learned is we have to start, we had to change our messaging a bit and stop talking about the bad things that would happen if we don't act. Instead, start talking about the good things that will happen when we do act. And it's just the other side of the same coin. And so, you know, as Tomás mentioned, New Zealand hadn't been highlighted in the news that much, but we've been trying to push it, but lately it has. So we've had, you know, in a certain way, We've been unsuccessful, as Tomás mentioned, because we are in our third wave. The things we warned that might happen happened, but it does mean that now people believe us, unfortunately. We were talking about hypotheticals and now people are living it. But we have changed our messaging. So now we're talking about, look, we can have hugs again. You can go to music gigs, you can do all of these kind of things. And with these wonderful people who have gravitated towards the group, this coming Monday is kind of one of these, it's not quite a festival day in Ireland, but it's kind of a low level festival. It's St. Bridget's Day, and it's officially recognized as the first day of spring. And so people there might be something. So we're launching our campaign, which is a people's campaign. And the reason we're doing that is not only to get the message out, but one of the things was that I realized, well, it was pointed out to me, and then I recognized that my involvement in this group is something that have made me feel a bit less useless and like kind of remove a sense of futility in these enormous world events that we can feel are happening to us, and we're just being washed over by it like a tidal wave. Giving people, so we try to kind of give this to people that they can do something, they can get involved in this, even if it's sticking a sticker in their front window of their house, or if it's putting something on social media. And that's the campaign, which will be launching. And the people who came forward to us a previous experience, so we had this pool of experience and talent to draw on, and they've made brilliant graphics, they've designed a campaign, and it's all, and I'm very optimistic that this is going to get more people involved and hopefully persuade the politicians a bit more. So that's maybe all I need to say for this. I'm happy to take questions later or listen to Anthony as well.
Take a couple of questions, or at least a couple. We have some time. How much did listening via asserting a point play out on those adversarial TV radio interviews?
So the listening, I'd be listening. I'll answer this in two different ways. I was listening to what the other people were saying, because I would call them up on, so in that kind of listening, right, carefully listening to when they were saying nothing, and I don't have any kind of hesitation to speak very frankly. So when somebody was speaking nonsense, I could go, look, that's nonsense, you just said blah, blah, blah. But also trying to listen to what I felt were the concerns of the general public, and who wouldn't necessarily be the person in the room with us. So sometimes trying to answer what the concerns were, or the misconceptions. And actually, it seems one of the most common misconceptions is that we love lockdown, and we just want it to be locked down forever, and that nobody should work again. And this is the most common misconception, because we've always asked for the lockdown to go a bit longer than the government, because we're like, you're not there yet, you need to go a bit further. They're like, well, you're the ones who love lockdown, you want it to be in lockdown forever. And we constantly be answering, no, the idea is to not be in lockdown again. The idea is to get out and stay out. And I used to have to always make this point, but I've noticed on social media now that more and more people are making that point for me. So somebody will message me on Twitter or something, where it's completely open. And before I'm even looking at Twitter again, I'll see several people have responded going, don't you understand? The whole point is that you get the lockdown right, and then you're not in lockdown anymore. Then you go back to your job. The point is you get back to your job, because they say, oh, look at you in your nice, fancy, cushy job. You're not affected by this. You're not suffering with a salary reduction and all of that kind of criticism, which of course it's true. I'm not suffering with a salary reduction. So the message is getting out, and then people are answering on my behalf. And so that was that kind of listening, yes, trying to listen to what is it people need, what is it people are afraid of. And even just this idea of trying to give people something they can do that makes them feel a little less helpless in this whole thing, even if it's a tiny gesture, that can help in a small way. Oh, somebody's asked, will I just look at the question, or do you want to read it out?
No, go ahead. Yeah.
Well, somebody has asked, how do you deal with accusations that it's not your lane? Yeah. I haven't actually been accused of that too much. And that's partly because of what Tomás mentioned, that some people just think all scientists are the same. So but I do say what I do actually in that general idea is I reference the group. So, and I say, I am a member of this group that includes all of these kinds of people, and only one of us can speak at a time, obviously. So, and that has been very useful for me. And actually one of the things we didn't do right at the beginning, but we have done much more lately, is we reference the group a lot, and it doesn't exactly roll off the tongue, but we've managed anyway, because we're the Independent Scientific Advocacy Group, and people always stumble over advocacy because they want to say advisory. But in any case, you know, you can tell we're scientists, not brand marketers. But that has helped because each of us brings our own thing. And, you know, we have in the group, we have economists, we have public health experts, epidemiologists, and we have scientists like me and Tomás, but we have people who are interested in political geography. Now we have people, human rights lawyers, but who have experience in enacting social change. And it's actually an extremely strong team, and data analysts of all kinds, and from both jurisdictions on the island of Ireland and all this. And that has been really helpful, because I'm kind of saying, I'm not just here speaking for me, I'm talking about considered analysis that has come from this really skilled group. And, you know, I just happen to be the one who's here speaking today. I don't go to all that length, but I just say our group includes blah, blah, blah. And then I say my stuff. But yeah, that helps.
Great. Thanks, Aoife. Let's move to Anthony.
Thank you very much, Yaneer. Tomás and Aoife have said a lot about where we've come from and how we got started. And maybe I might talk a little bit about some of the political strategies we've used. We've tried as far as possible. It hasn't always been possible, but we have tried as far as possible to avoid getting into a row about a row with the government. So we're not saying the government is responsible for COVID-19. We're saying the government has taken certain decisions, the government has made certain choices, and the government still has choices. But we're trying to frame this as a choice for the government. And the government makes a choice which says we keep living with the virus, which is the official description of our current policy. Dying with the virus might be more accurate, but would be a lot harder to sell. And the price of that, we have been arguing for a long time, is repeated lockdowns. And I received considerable criticism for turning up at the front page of one of our newspapers with a photograph that made me look like an Old Testament prophet emerging on this occasion from the sea, because of the angle it was taken at, but predicting that there would be 3 or 4 further lockdowns before all this ran out. And that was in October. And so far we've managed 2 more lockdowns. I'm rather hoping we won't manage the rest. We've managed, by saying yo-yo lockdowns an enormous amount and make this the last lockdown an enormous amount, to get both those phrases into common use. So people are talking about it. We actually stole the yo-yo lockdown phrase from the chair of the Restaurant Association. We've had conversations with a lot of the lobby groups, including lobby groups who were saying the most awful thing about us, that we wanted to drive their members out, that we wanted to stop people drinking, we wanted to stop people going out, we wanted to stop people having a good time. But we've had careful and reasoned conversations with the executives in these lobby groups and with senior members in these lobby groups. And Yaneer has been part of some of those, which has been immensely helpful. And that has done a lot of conversion in the background. We have been dealing with a challenge with the civil service. The Irish civil service is innumerate to an almost incredible degree. They don't get numbers. To put it in perspective, our Department of Finance at the time we had one of the world's largest banking collapses had no economists, which is pretty astonishing. And actually it hasn't changed all that much. So we're trying to explain exponential growth to people to whose brain just switches off when you show them multiplication symbols. They don't understand what we're talking about. We've managed to get somewhere by doing a lot of work with graphics. So one of our colleagues, Paul Dempsey, has been producing very regular graphics showing what's going on. And there are a couple of other people around the country doing the same thing. And that's been really useful in getting messages across. So we followed a very wide communication strategy. We do a lot of public communication. We do a lot of work on rural radio stations. I was on a radio station in the center of the country the other day. I was only on for 8 minutes or 6 minutes. But when I came off, the producer said, look, thank you very much. It's very hard for us to get people to talk on our station because we covered 3 counties with a population of 150,000 people. But by being available for that, we have actually reached a lot of people who get their information from local radio. The local radio is a very important messaging tool in Ireland. I think we probably have fallen down on social media engagement with younger people. So very active on Twitter, which is great because we got the journalists. Journalists live on Twitter. We have not been so successful or so active on other social media platforms, though that may be changing on Monday. We've written a lot of op-eds, we've had presentations, we've had regular seminars. So we do stuff at a whole range of different technical levels, but all trying to bang home the same message. That this virus is a serious problem, that Europe is making a dog's breakfast of managing it. We normally focus comparison on other European countries, but we point to Australia, we point to New Zealand because they're very familiar to Irish people. Most Irish people have relatives of some description in Australia, not as many as we have in the United States, but a fair few. So we think we know Australia. So when we talk about Vietnam, which has arguably been much more successful than Australia, or we talk about Taiwan, people don't know those countries and it doesn't mean very much to them. And that process of engagement across a very wide span, private engagement, we've had private meetings with, I think, all the political parties at this point. We've had private meetings with members of our parliament. We've had private meetings with ministers, civil servants. We've had private meetings with industry bodies. That whole range of stuff, accompanied by a lot of time spent explaining stuff to journalists. So we all talk regularly to, I don't know if you have the concept of a tabloid newspaper in the United States, but our major newspapers are the Irish Times, which is written at a reading age of roughly 16, 17. The Irish Independent, which is about 15. And the Sun, the Mirror, and the Mail, which are written at a reading age of about 12. Guess which papers get more read? So we spend a lot of time talking to journalists from all the papers and explaining things to the journalists. So we have effectively an educational program for journalists. So I will spend 15 minutes talking about vaccination to a journalist. I'll spend, and all my colleagues are doing the same thing. I'll spend 10 minutes explaining herd immunity to a journalist. And as time goes by, they pick it up because although they don't have usually science or biology backgrounds, they're also not stupid. Their job is to assimilate information and make sense out of it, make a story out of it. So over time, the scientific, if you like, of the reporting has become more substantial. And I think we're not the only people who've been responsible for that, but I think we've played a part in that. Ireland has advantages for doing this sort of thing because it's a small country. I don't know how you would go about doing this in a very large country like yours with what is a very fractured media market. But part of it is about being approachable. Part of it is about being consistent. I'm very friendly with a retired Irish Minister for Justice. And she said to me about 10 years ago, something which has guided me ever since. She said, you tell people something 19 times and they look at you as if you come out from underneath a cabbage and make faces at them. And the 20th time you tell them the same thing, they look at you and say, I always thought that. And that seems to work. I won't go bail on the evidence for 19 versus 20, but I think repeated, consistent messaging does get across, even quite complex messages. Vaccines are great, but will not work quickly. Vaccines are great, but will not get us back to normal till Christmas. Lockdowns do more damage to the economy and jobs than, the virus does more damage to the economy and jobs than lockdowns. The advantages in controlling the virus quickly are huge. Look at New Zealand. The Irish love sport, and the degree of national collective envy directed at New Zealand when they reopened for sport was quite extraordinary. And we've used that. We've used that as our positive message. Do this, accept this challenge now, and good things will happen. And I think that framing, as Aoife described, has been very helpful and very successful. And that's pretty much what I want to say.
Okay, so thank you very much. So we have some time for questions, and I'm going to go back to my initial question and ask either any one of you three to take upon yourself to explain, as if you were explaining it on radio or TV, what we're about. I think it will be helpful for people who are here to model that. Who would like to go first? Tomás, you're muted, so if you want.
I learned an awful lot about how to do this throughout the process. So much of it depends on the context. So if you're doing this, you have to be playing with the theory of mind of your audience. So you have to know what they know, and that means you have to be reading the media from their perspective, and you have to be aware of what the opinion is at the time. It's completely different if you're in an infection peak or if you're in a trough, if you're on your way down, if you're on your way up. The public mood is entirely different in each of those things. And the way journalists and the media will pose the questions is entirely different. But I think we made a lot of mistakes in not focusing enough on the why are we doing this? So what are we talking about here? A lot of people will say, from the beginning, you want to destroy the economy to save lives. Now that would be a reasonable debate in itself. And some people engage exactly in that debate. But of course, it's not about that. They're trying to save everything from falling apart, because when you have people who don't understand the numbers well enough that we're going to keep going up to the cliff and keep shutting everything down as a result, that will happen again and again and again. And you think it's obvious, but it's not obvious. It is obvious to a large chunk of the public, but to a lot of people who are decision makers, who are journalists, who are politicians, they actually don't get that. And so they've created this view, which it's actually an honest misconception they have, which is that we want to destroy the economy to save an extra few hundred lives. And these are reasonable people. They're not herd immunity people or anything like that. And so you've got to deal with this. And so you try and explain that the economy and health are not separate. That takes months before that becomes accepted by a lot of people. But what we were missing through all of that was we were doing it like scientists. We were doing it like academics. Even though we were communicating in everyday language, the content of what we were saying would have been understandable to people who would be reading the broadsheet newspapers. We didn't give enough time to selling the reward, to selling why we're doing it. And the why you're doing it is so we can be like it is in New Zealand. And most people don't know what it's like in New Zealand, right? Even in Ireland, most people are not actually on Twitter looking at what concerts in New Zealand. Particularly the middle ground, like the centrist 40% comfortable middle class people who will follow the government, whatever they're doing, they're not seeing what's happening in Australia and New Zealand. I would probably imagine it's even more like that in the USA. And I mean, I think you have the added complication of whatever America is doing must be the best way of doing it, which, you know, has is a component of certain mentalities. So I think that is a difficult one to break. But you've got to start with, why are we doing this? The why we're doing this is we want to be able to have family gatherings whenever we want. We want to be able to have stadiums full of people. We want to be able to have concerts again. We want to be able to do everything socially that was important to us. Schools open, universities open, without face masks, without risk and uncertainty, businesses without risk and uncertainty. You know, even in many of us here are scientists, we know that this we're treading water. We're getting research done now, but a lot of things aren't happening. That a lot of seeds aren't being planted right now, I feel, in terms of long-term projects, because there's not enough travel, there's not enough cross-pollination. There's a lot of we're definitely thinking about the next grant and the next paper, but I feel like the cost to international research is going to be borne out over years. I suspect the same is true of all of business, that businesses are surviving, sure, some are, but you're not going to have a lot of long-term creative investment type thinking because nothing is predictable. And this is part of the whole problem. You remove that when you're living in the Australian or New Zealand situation. So you got to focus on the rewards. And I think that when you're in a communication dispatch, whether it's oral or written, 65% of it needs to be about the story. It needs to be about that. It needs to be about what are we going to get out of this, and why do we want to do that, and just posing that. And then you bring in the science, which is the how are we going to do it? And the how is the conceptual strategy, and that's the middle part. And then the last part is the what. And the what is the nuts and bolts of it, the concrete stuff, testing, tracing, quarantine, whatever. Now, I think that to get people to pay attention to the what, you need the why is the crucial thing. So the how is the crucial thing. The why is the most important. The why is what gets people to buy into you and understand what it's about. The what is what you want them to do, but the how is that middle crux, and the crux has to give them a very simple insight. And I learned this from reverse engineering Thomas Puyo's writing, which is that he starts with meeting the reader or the viewer where they are and acknowledging the problem. And then he gives them one crucial insight that changes how they view the problem. And once they buy into that, you have their full attention, you have their full memory, and then you can give the what, and then you just give the information, and they will consume it and remember it. And I've been adopting this style of communication since the beginning, except that I got the first part wrong, which is whenever I was giving the why, I was giving the why as though I was talking to all of you, or as though I was talking to, you know, versions of myself who are 2 months behind me. In that, look, this is the real problem, and so that this is how we solve it. That's not how everyone's thinking about it. So you got to start with the why of the audience you're talking to. And for most people, they want their lives back. And you have to communicate that this is the way to having their.
Okay, good. I don't know what the beep was, but it's a good time to switch to Aoife.
But so I noticed a question there in the chat I might quickly answer, and then I'll maybe ask you again what you were asking, because I hadn't 100% caught what you were asking us, but there was a question about how to explain the numbers, and I think I came up with a good way of doing that. So I wanted to answer that. You know, exponential growth, one of the problems with exponential growth is it's not intuitive for most of us. And, you know, last summer, Ireland had days with 3 cases in the entire country. And then they opened up, and you know, when it became 6 cases and 10 cases and 12 cases, it was hard to explain to people why that was a bad thing. They're going, come on, it's 12 cases, it's brilliant. And, you know, and so it is very hard to explain to people how that's not okay. And there's this old legend story that I now have co-opted for this purpose, which is this one where there's a craftsman has made a chessboard for some prince or a Raj or something, and they discussed the payment for the chessboard. And the craftsman said, well, I have 1 grain of rice on the first square, 2 on the second, 4 on the third, etc., doubling every square, and I'll take what's on the 64th square. And the prince thinks he's made a killing, and he goes, fine, I'll deal with that. This fool of a craftsman, such a cheap price. And they realize that what's on the 64th square is something like 1,000 years of global production of rice. So it looks innocent at the beginning, but it gets out of control very quickly. And so I use that to explain the numbers. And that's one that people can play with mentally as well. And it also makes a big difference. You know, stopping a few squares earlier makes a big difference. Like if you could have stopped 5 squares earlier, it might have been affordable. Maybe still very expensive, but it wouldn't have been 1,000 years of rice. So, you know, but it gets it, that kind of, that's what I use for that. But Yaneer, were you asking, you know, how do we explain what it is we're trying to do as a group, or how do we explain what is zero COVID? Or
Yeah, we're kind of low on time at this point.
Okay,
you could take a moment and just say, what I was hoping is you just take an example of where you've explained something and just do it here so that people can hear it. That may be too hard because it's out of context, as Tomás started to say. You need a context.
Yeah.
And maybe
well, I have a few times just decided to do a little rant to camera and publish it on Twitter. That was under your encouragement, Yaneer. But what I have done, you know, so because we have our government that keeps saying, oh, we don't want zero COVID. So I just pick up my phone and go, well, what do you want? Zero COVID is when we catch all the cases. There's no mystery transmission in the country. We know where the virus is and people can go about your life as normal. Why don't you want that? And if you don't want that, what is it you want? And I go on a rant like that. And so that's a kind of example without going on for too long because time is tight. But I tend Tomás has just shared my rant there in the but I you know, different people have different styles, and I think that's another advantage in our group, that we're not all the same as each other. I tend well, people tell me they think I'm a kind of very frank, straight, you know, ordinary speaker, which maybe connects with some people, and you know, then and so maybe that is also an advantage. And it does mean that when I'm on one of these political debate shows and I'm beside an elected politician of, you know, 40 years experience, I'm not at all shy to just say, no, what you just said is complete rubbish for these few reasons. And so I'm, you know, I ought to have more manners, but I don't.
Fabulous, Aoife. Anthony, give us a few minutes of your
okay. All of you who, what I say to people is, all of you are experiencing the burdens of living with COVID. You can't go out. You may not be able to go to work. You're
We're losing Anthony, I'm afraid.
Holidays. You can't travel. You can't see your relatives. For a wedding. Maybe you haven't been able to go to a funeral. Way out of all of these, the virus under control. And you'll hear this is no worse than flu. Audible at this point? I'll turn off my camera. Yeah, it's good to imagine my friendly, smiling face. So I try and just, and obviously it changes as time goes by, the situation changes. At the time when we were having very few cases a day, I tended to say things like, well, you've been through the severe restrictions because of high numbers of COVID cases. And that's coming back. And it's going to take some time. But when it comes back, it will be just as unpleasant as it was the first time. So let's deal with it. When we're in the first lockdown, which started in March of last year, I would say, well, this is not great. This is not good. But what we need to do with this is to take the opportunity of controlling this so it doesn't come back to bite us again. So we get our lives back after the lockdown. And that's pretty much what we're saying now. We're saying, you know, we have a very severe lockdown. The government is suggesting at the moment it will last till something like early March, or maybe middle of March, or maybe April, or maybe May. We don't know. But what we're arguing is we're getting the pain, but we're not getting the advantage. The advantage is we use this time to bring the virus under control. And we have a very short list of things we need to do that we're not doing. So improve public health, improve contact tracing, manage the border with Northern Ireland, manage very aggressively people coming into the country, but bearing in mind that we need special arrangements for freight, for air crew, for ships crew and the like. And we get our lives back. Things go back to normal. We can open the pubs. We can go to a restaurant. No, you won't be able to go on holidays to Spain this summer, but you can plan a holiday in Cork with confidence that you will be able to go, that you won't be sitting back in Dublin with your booking in Cork going to waste. And that's how we're pitching it at the moment. So it's very much, where are we now? What do we need to do to get somewhere nicer? And what does somewhere nicer look like? And if people have specific questions, I mean, I've been asked detailed questions about contact tracing. What is it? Was it done? And all of that. And I just answer that. But most people don't ask me detailed questions about contact tracing. If the politicians today were saying, you know, they want to seal the border and close the country. So our response was, well, we don't want to seal the border. You can't seal the border, and it's not in any way necessary to seal the border. And yet the country needs to stay open so that we can bring in freight, we can bring in supplies, we can manage air crew, we manage sailors, we manage travelers differently. We quarantine travelers for a period of time. So every time the most usual attack against us is that what we want to do will pose unbearable burdens on society. And what we say in response to that is we're having the unbearable burdens right now. Our schools are closed. Our children's education is at risk. Special schools are closed. Mental health is at risk. Jobs are at risk. And that's all resonating with people because they see it in their own lives.
Anthony,
and that's how we put
thank
it.
you, Anthony, Aoife, Tomás. Maybe we'll take, there is time in the program because they've given me a lot of time to do introductions, so we're not late. Let's take another couple of questions, or at least one. Do you want to pick one question out of the, let's see. So there's one question that just popped up. Maybe someone will take it. How does the public react? Let's talk about the public reaction some more. If you would like, who would like to talk about it? Maybe Aoife, you would like to take that on, please.
I think there's been a very understandable reaction from the public, one that we've needed to explain away in a sense, which is the first lockdown didn't work. What's the point of another lockdown? Because they think, you know, we did a lockdown. why are we being asked to do another one? And to which I respond going, yes, you did. And you did everything that's possible. The first lockdown achieved everything that a lockdown can achieve. And there's nothing more you could have done. And you did nothing more we could have asked of you. And the reason we need to ask you again is because of political failures. So I go totally on their side and I go, yes, you did. You made all the sacrifices, because that was very difficult for people. They're going, look, it doesn't work. What's the point? We did lockdown. It didn't work. Here we are still dealing with this thing. It's not working. So that was the reaction. And then the second lockdown, that was the reaction. It really changed now because we saw ourselves, on repeat, towards the end of that second lockdown, which was only 6 weeks, that people were itching to open up. And it was made worse by the fact that it was becoming December and people wanted to start doing Christmas things. And we hadn't started the lockdown as soon as we should, because the public health advice was to start it 2 weeks earlier. So it could have been 8 weeks at that point, and it might have been a safer reopening had they started when they did. But now people are understanding really well that this is a yo-yo cycle. And unfortunately, our explanations of the theory were not sufficient. They had to live the reality. So we should be humble in that. It's not like we explained it so well. It's like, no, they just lived it. So it's not like we are such great communicators. Not everybody got the message when we were only talking about what might happen. Now they see it is happening. But yeah, the public mood has really shifted. And I've even seen it in the interviews I've done, because whereas there might have been quite an antagonistic approach in my first interviews, now it's all, everybody's like, well, of course you're right. It's so good to finally talk to somebody who speaks sense, so this is a total transformation. And actually in these things, I end up, like I mentioned, sometimes actually debating with the politician. And there was a politician who I was debating with in November about possibly reopening in December. And I was saying, no, we shouldn't. It's not the right thing to do. You can't open the pubs. This is what's going to happen. And he was going, no, it's not. Anyway, today he came out in favor of zero COVID. I don't think it was me who persuaded him, but maybe his constituents did. And but yeah, the message is getting out and people are changing. So let's hope. I feel I feel quite sad at the deaths I'm seeing this month, because I feel they were all preventable deaths. And that's very depressing. And it just so happens that one of them is the father of a close friend of mine. And I feel, I feel angry sometimes that was let happen. And, but I think the public are feeling this third wave is our biggest, deepest crisis yet. And I think everybody says now they see people, they know people close to them. It seems to have reached into so many people's lives, much more than the previous ones.
Okay, so I think we've benefited tremendously from the presentations of Anthony, Aoife, and Tomás. And I can very much commend everybody to listen to the webinars that they have been doing. They're a symphony of teamwork and of insight. They're available on the ISAG website. If someone wants to, it's just isagcovid19.org. Please, I would like to have a round of applause. It's not easy on Zoom, but thank you very much for joining us. Obviously, we look forward to more presentations and opportunities for us to interact. Thank you very much.
Thank you very much.
Yaneer. Pleasure.
So I would like to...
Yaneer, can I just say something before I go? You've been incredibly helpful to us getting our act together, advising us, pointing us in sensible directions at every turn. I just want you to know it's appreciated.
Thank you very much, Anthony. Really appreciate that too. Again, thanks. I want to turn now to Ian Town, who is Chief Scientist of the Ministry of Health in New Zealand. And as everyone here, I'm sure knows, I think many would have preferred if what New Zealand did was what everyone else had done, and we would now be enjoying the joy and conditions that are present in New Zealand. So Ian, thank you very much for joining us and helping us understand how you've been so successful. Thank you.
Well, thank you, Yaneer. Can you hear me clearly? I'm a long way away, but
yes,
I've
yes,
got
we
everything
can.
well.
And thank you for joining us early in your morning.
That's fine. Can you see my screen share, colleagues?
Yes, we can. We can see your screen.
Thank you. Well, a very warm welcome from down under in New Zealand, and just want to start by acknowledging the courage of our colleagues around the world, including those speakers who have stood up for what they believe in and who have championed science. It's very distressing for us here in New Zealand to see friends and colleagues in science and the medical profession suffering so badly with the pandemic in other countries. And so I want to just acknowledge that, and there's no sense of smugness or overachievement in New Zealand. We remain watchful and cautious in regard to the ongoing risk that we all face internationally with this pandemic that's out of control in so many countries. So my background is as a respiratory physician. I've been here at the ministry for 2 years. I wasn't expecting to be in the eye of a storm, but in some ways my professional background assisted me to understand the risks of a uncontained, of a pandemic of a viral nature such as COVID-19. So in the next 20 minutes, I'll just go through this slide deck with you, which will chart the course here in New Zealand. I'll try and comment on things that may be helpful for colleagues in other countries, and naturally happy to be contacted afterwards. So we've just come back from our summer holidays, and it's exactly a year ago that we returned from those holidays to the early reports from Wuhan. And like many of us, we had no inkling about what was to happen here in New Zealand and worldwide. So this paper in the Lancet describes the early New Zealand experience. I'll use some of the illustrations from this to tell you a little bit about the time course and the management of the pandemic here in New Zealand, but this is an excellent summary of the early days. And from that summary, you can see here the graph which shows the exponential growth in cases. For our Irish colleagues, I was once quoted as saying, "What part of exponential don't you understand?" when trying to explain the risk. And of course, here is the small but exponential growth of cases in New Zealand. And of course, all our cases were imported, the first case from Iran, and the outbreak proceeded throughout March with import-related cases and then local transmission, community transmission from about the 15th of March through towards the end of April. And that was the initial pattern. And here is the extended case report numbers on a daily basis from here in New Zealand. You can see there on the left of the screen the condensed version of the March, April, May outbreak, and then a prolonged period of no community transmission. The middle of June, we detected cases in the community. And this graph looks very like the graph from New South Wales in Australia, where we've continued to have small outbreaks, cases latterly, all breaches in our managed isolation facilities where there's been a leakage of a case, usually through a staff member. And we're currently dealing with such a breach right now in the late part of January. So we have a number of cases that have breached out of one of our quarantine hotels in Auckland. There will be nothing surprising here, only the small scale of the age distribution here in New Zealand, and only 25 deaths have occurred here. And they are illustrated in those tiny red bars you can see, which are illustrating the same pattern of the majority of deaths occurring in the very elderly and those with underlying medical conditions. This is our daily situation report, which at a glance tells you roughly what's been going on in New Zealand in the recent time. So you can see there that on the top right-hand box, the new case that was identified from the hotel a few days ago, there are now 5 or 6 cases, all from the same floor in the single isolation hotel. The number of laboratory tests, the number of cases that have now recovered. And as you can see, New Zealand has been aggressively testing anyone with symptoms, with about 1.5 million tests having been completed so far. So you'll be hearing shortly from Professor Michael Baker, my colleague at the University of Otago, and he will, I'm sure, refer to the early modelling. Many countries, of course, undertook modelling using the same or similar methodology, the early discussion about what the R0 value meant, and then the predictions about the number of deaths and the number of health service challenges that would be encountered in the absence of control measures. So it was the early modelling, and we had local modellers, including Professor Nick Wilson, Michael's colleague, and those models certainly alarmed the politicians in New Zealand, and I've used the word galvanised before. They were certainly galvanised into very quick action. Here's our Prime Minister, the Right Honourable Jacinda Ardern, using a graphic, and I've sent a link in the chat to some of these graphics from the spin-off, which have been enormously helpful in communicating public simple concepts. And this is the flatten the curve graphic, which was widely used early on and predated, I think, the discussions about whether or not we could achieve elimination. So in the early phases, we didn't really consider elimination as a possibility, but later it became evident that it was feasible. Public health in New Zealand was in a parlous state, and many countries have observed this problem where decades of underinvestment meant that public health practitioners were not prominent, either in our medical schools in terms of training, but also the network of community-based public health professionals was fairly scanty here in New Zealand. And so the very simple premises that have served us well, there's no rocket science here. These are the things that you've all been talking about and were the suite of public health interventions that were identified in New Zealand. And these were captured in this very first version generated in early March of the risk levels and the alert levels with the actions that would be taken. These were based on the Singaporean model, which colleagues shared with us and put into this brand, which we have used extensively. These colours, these graphics have been used in a national campaign, which continues now, anticipating the rollout of vaccines. And so the New Zealand public got very familiar with these levels, level 1, 2, 3, and 4. In the early days, of course, we actually raced very quickly from level 1 through 2, 3, and a few days later into level 4, which is effectively as tough a lockdown, to use that term, as has been implemented anywhere in the world. And this is pretty hard to see. I'm happy to share this with the meeting organisers, but what you can see illustrated here is the sort of the sequence of government decisions that were made during February and then more urgent decisions in early May. And you can see here the imposition about this day here of alert level 4 led to an immediate control of the community transmission of cases. And we held on to this for a long time. As you can see, level 4 went on right until the end of March. And in a very precautionary set of decisions, we didn't release New Zealand to alert level 3 until early May, in effect. And that took a lot of political courage, as has been observed. So with acknowledgement to Michael Baker and his colleagues, we eventually cottoned on to the idea about an elimination strategy, and this was agreed by our government eventually in May, but the actions to empower this approach had been agreed verbally with ministerial colleagues much earlier than the final date of signing and publication, which was at the 8th of May. And the 4 pillars of this strategy are very obvious, have already been referred to during the meeting. border controls at the heart of it, case detection. Contact tracing has been mentioned by a couple of you already, and contact tracing started very poorly in New Zealand with manual systems and paper-based, but we moved quickly to a national database using Salesforce, interestingly, a commercial platform, and then the development and deployment of an app, which has recently had Bluetooth capability added to it. And so that improvement in technology has sped up our contact tracing enormously. And then finally, the social license. Several people have touched on this already. This is at the heart of community support. And so just as we do in sport, we've heard about rugby, which is a pretty strong unifying sport here in New Zealand. The team of 5 million is something that the Prime Minister has used repeatedly to bind us together into collective action. Now, this is from Professor Baker's BMJ paper from late last year, and it was very helpful for us to have a bit of a mini tutorial, if you like, about what the choices facing governments might be, i.e. the language of this public health intervention, and the need to understand that elimination didn't really mean eradication, and the acceptance then of the pattern of disease that I've described allows for the stamping out of small outbreaks when they inevitably occur. And so that's been embraced and I think more widely understood as being at the heart of the elimination strategy for New Zealand. And just to touch on that, well, why? Because we can, we could, and those definitions became important to have a shared understanding of those. Obviously, unlike many landlocked countries, we are a long way from everywhere. And so the very courageous decision to virtually close our borders to everyone was surely an important, albeit costly decision. We've talked about population density. Obviously, we watched with alarm some of the rapid outbreaks in densely populated parts of Asia and other developing countries. But in reality, outside Auckland, our population is not densely not dense, and so there are natural spaces in wider public facilities, and maintaining physical distancing was an easier prospect than in some places, particularly who operate mass transit, for example. I'll come back to the science-led response, but for those of you in that space, it has been heartwarming here in New Zealand in terms of the willingness of our senior politicians to follow science advice. And as always down under, we have very strong alignment with our Australian colleagues. So from day one, we have been aligning our science advice, our planning, our strategy, our public health interventions, and our approach to government with Australian colleagues. There have been differences. Those differences have been minor, and in general, Australia has achieved similar results to New Zealand, as has been mentioned. So just back to that public health response, it doesn't bear repeating to this audience, but the last bullet point there is something that we've been trying to adjust our thinking, that the control measures don't include going back to level 4 every time there's a minor outbreak. And this has been something that has been a journey for us in terms of our own thinking about the public health interventions and trying to get proportional responses and a more nuanced set of interventions. And so the government has asked us to do that, obviously, because it helps protect the economy. If we can have a proportional response and undertake rapid contact tracing and contain an outbreak, that will avoid more drastic national level action. So the mainstay for New Zealand has been keeping it out, and that has been a catchphrase for government and the wider public. Despite that, over 100,000 New Zealand citizens and some specialist workers and sports teams have crossed the border safely in managed isolation, 14 days in a strictly supervised hotel environment. The current outbreak appears to be, as I've mentioned, a leakage of cases who had tested negative at the end of their 12-day testing period prior to release, who have tested positive subsequently, and we're trying urgently using whole genome sequencing and other laboratory methods to try and understand what the South African variant, which is what we're dealing with here, may be behaving slightly differently in terms of its behavior in hosts. We have focused very much on the air border, and we've had to be very strict with our national airline and with incoming airlines to make sure that crew monitor and are monitored in appropriate levels of isolation during layovers. And we have a very long coastline, so it has been pretty challenging to manage entry across the marine border. So in terms of the science, obviously the whole genome sequencing has been a breakthrough for us and many other countries. We are able to do it within about 8 hours of a sample arriving at the laboratory with the rapid protocols, and we've been able to track and trace and compare whole genome sequencing with our epidemiological data for several months now. And this is a vital tool in understanding clusters. This is our last large outbreak, which started in a cool store in the city of Auckland, and the whole genome sequencing provided us with clear clues as to where the contacts and the transmission had occurred in other workplaces and the wider community. So in this privileged position, we are looking at vaccines not to manage the pandemic and the risk of ill health and deaths, but rather to continue to protect the border and our wider citizens. And we have been involved with COVAX and the other international consortia to obtain vaccines. And this is the current status in New Zealand in terms of the acquisition of vaccines. We have negotiated vaccine acquisition from these 4 companies and expect to have the first doses in New Zealand in 2 or 3 weeks' time, and they'll be deployed at the border in the first instance. So before I finish and take any questions that you may have, I've just tried to think about the success factors and the future for New Zealand. So we continue to aggressively pursue the elimination strategy, and notwithstanding the current outbreak, we have achieved that at least twice. Obviously, our border at a distance from everyone else, apart from Australia and the Pacific, is our key risk, and we'll be continuing managed isolation as a key protection for those arriving in New Zealand. We have had tentative safe travel zone discussions. We've just opened up one with the Cook Islands, which has been an easy decision. With respect to Australia, it's an on-again, off-again conversation. We have had some quarantine-free flights to Australia, but none so far to New Zealand. So the New Zealand government has taken a pretty hard line, and while states in Australia such as Tasmania and Western Australia have not had any cases, we've yet to open the border to travellers coming directly from those regions, but we will likely do so in the coming weeks. We are struggling right now to understand some of the testing profiles that we've observed. Cases testing positive after quarantine and negative tested is a new issue for us, which we're grappling with at the moment. And of course, as people recover and have vaccination, then their immune status will need to be more clearly understood as they arrive in New Zealand. So in hindsight, the critical factors have been the Prime Minister's own personal leadership. There was an awkward moment when effectively the then Minister of Health was stood down by the Prime Minister, and she took over the leadership of the response and became the Minister of Health in all but name. And she led this from the beginning. She had an insatiable appetite for detail. She had an extraordinary grasp of the information that she was being provided with. Various officials, including myself, were frequently summoned to her office to provide updates and debate opportunities for continuing the elimination strategy. And our academic colleagues, I should acknowledge them from around New Zealand and around the world who have had a challenge function throughout. They have had wide media coverage, which has been balanced and sensible, and that has provided another voice, other than directly through officials such as myself, to the government to provide advice. Our Director General of Health, Dr. Ashley Bloomfield, has become something of a cult figure in the media. He has fan clubs and T-shirts and hats with his image on it. He has become highly trusted, and every day in the early phase of the pandemic response throughout March, April and May, he gave a daily address to the nation about what was happening, what we were doing. To go back to our Irish messages there, the colleagues pointed out that the how and the why need to be linked with the what. And that's been a lesson that we learned early on. And the Unified Communications campaign has been exactly that, that brand: unite against COVID-19, staying safe, washing your hands, staying within the guidelines of each level have been absolutely crucial to maintain the social license. So looking ahead for us, this working together as a team has been a national effort. Here in New Zealand, unlike sadly many colleagues overseas, we have a problem with complacency. We've had a reasonably free and easy summer holiday period. Our economy has recovered quickly, and there's elements of that where the domestic economy has been boosted by our sort of non-manufacturing economy, where we've still been able to export fruit and produce around the world in our airline, which has had no passengers but often carried hundreds of thousands of tons of freight. And domestic travel and tourism has undergone a massive resurgence as people spend their holiday money out normally in Australia or the Pacific, have spent that money in New Zealand. So back to the public health system. In closing, our public health system will be rebuilt. This is the wake-up call. It will take some time, but I think we will be better prepared. And our science leadership group is advocating for the strongest possible investment in infectious diseases, research and surveillance capability. So thank you very much for the opportunity to talk with you today. I hope you found that helpful, and I'm happy to answer questions now or in the coming days by email. Thank you.
Very good. Thank you very much, Ian. It's really incredible to hear the story. And why don't we take a couple of questions? We do have about a few minutes. Who has, there was one question that I saw already. Are there people who in New Zealand who are actually unhappy with what was done and might be, you know, saying, well, why don't we do what is done elsewhere in the world?
Yes, well, that's an excellent question, and it would be surprising, wouldn't it, if there were no doubters at all. So the team of 5 million has had its critics. There has been a sense that the top-down approach has not been particularly inclusive for some members of society. We have been at pains to engage with, support and champion the needs of Māori and Pacific Island people living in New Zealand, because their outcomes from infections are generally substantially poorer than for other members of society. And we have had a Plan B team. Plan B came very early and modelled itself on Sweden's response. There were calls for the lockdowns to be ended. These folk got quite a wide audience in the run-up to our general election, which occurred in November and saw the current government overwhelmingly return to office. But a number of the opposition parties vying for votes had got involved with our Plan B colleagues, some of whom hold academic positions in New Zealand universities. And there have been some slightly testy exchanges, I'd have to say, between officials and some of our colleagues, just where academic freedom ends and being irresponsible starts, I think is a slightly fuzzy line. And I have taken to print media to rebut some of the claims made by those individuals.
Thank you. There's another question. Most Western governments seem to have largely dusted off their pandemic flu playbooks to manage COVID-19. But of course, COVID is not the flu. What was New Zealand's original plan? And I don't know, maybe Michael will be addressing this, but please say what was the original plan and what was the trigger for the change?
Thank you. That's a really good question too. So our influenza pandemic plan was the only document available. It would be fair to say that it was heavily coated in dust, probably had not been modelled or run in mock or real-time exercises for a decade. You'll recall that the WHO ranked us extremely poorly in terms of pandemic preparedness. And it'll be interesting to reflect on the comparison between the ranking and the outcome. I recall that the US, unfortunately, was probably higher than New Zealand. So the differences there are being discussed, obviously, at every level of wider society. Michael will comment on this, but was there a plan? Not really. Was there time for a plan? No. I think the agility of the science community and the willingness of the government to understand the different epidemiology of COVID-19, the way in which the exponential infections occurred and the need for urgent action just galvanized themselves in decisions that were made often late at night after hurriedly brought together advisory groups. Michael has been part of our technical advisory group from the get-go, and they've provided a crucial role in providing a sounding board and advice for me and my colleagues here at the ministry and providing guidance. So we now have a whole series of resurgence plans, which is the current language for New Zealand. Those resurgence plans obviously diverge enormously from what would have been a flu pandemic plan for obvious reasons.
So I have a question. At what point did you see that your plan diverged from much of the Western world? And what have been the opportunities or the thoughts that you've had about engaging with the broader conditions?
Yeah, well, I don't think we didn't really have time to reflect on that, to be honest. Yaneer, it was a white knuckle ride. It felt like we were in the eye of a hurricane. The normal machinery of government was collapsed into an all-of-government emergency response team. As I've said, the Prime Minister took individual control of the whole thing. Our line of sight probably was aided by the really collegial nature of what was happening in Australia and the willingness of their officials to talk to us on a daily basis. So that was helpful. And then, recognizing that we're part of an international science community, we remained incredibly grateful for the advice that we got from other countries. But we could see that where that advice was not being followed, as well as it was in New Zealand, that the outcomes were starting to be radically different.
Okay. So thank you very much. It's really incredible to have you here. I know your time is limited. Is there something else, maybe not as part of a formal presentation, but any other thoughts that you have that you would like to share with our group?
Well, just to acknowledge the suffering that's occurring internationally in other countries, and to repeat the offer that if there's anything that anyone would like to talk to us about in terms of strategy, be it communication, be it the machinery of government, be the development of policy, we stand ready to support that and would do so very willingly at any time.
Thank you. That's incredibly helpful. Okay, and so now I would like to turn to Michael Baker, who is a well-known epidemiologist and a public health expert in New Zealand, and as far as I'm told, was the architect of this incredible response effort. Michael, would you like to take it away? I think you're muted, though.
Yes, thank you. Look, a huge thank you, Yaneer, for the introduction and also for your leadership in at a global level with getting this meeting together. And I think it's the culmination of of a long-term effort on your part. So thank you. And I also wanted to pay huge tribute to Ian Town, because he has been, I know it wasn't in his job description to have to confront a pandemic, but he's done an outstanding job in, I think, being the person who we can all go to get science, a science overview of the response in New Zealand, and a critical leader in how New Zealand has responded throughout this whole period. And I was listening to the experience in Ireland and obviously looking globally, and we know we're talking with like-minded people here. We're just aware of the incredible frustration that we're all feeling with trying to translate science and good public health principles into action. And I think we were so fortunate in New Zealand that we had a courageous government that would listen. And I think that's and I'll come back to this in my presentation, the abiding lesson from all of this is the partnership between science and political leadership is just so critically important. So I'll just move on now to this presentation. And again, I think the host says it's disabled screen sharing. I'm assuming that's...
Are you not able to do that? Let me find out who is the current host. Either Matthew or Kim or maybe do I have that authority now? Let me just see what I can
Katie
do.
is host.
Katie is host.
Okay.
I'm sorry, what are we trying to do? I think
Katie,
we're
apparently Katie is host, so she can allow Michael to share his screen.
Oh.
Here, just one moment.
Thanks.
Just having a little trouble.
Permissions today have been fussy.
And I'm going to it's still not, it's still disabling me from screen sharing, but
You're okay now.
You can do it now.
Oh, brilliant. Okay, thank you very much. Can you see that now?
Not yet. Are you able to share?
Yeah.
There we go.
Oh, great.
There we go.
Okay.
Perfect.
So I'm really going to build on Ian's excellent summary. And what are some of, I guess, focusing on some of the lessons that hopefully are generalizable from the New Zealand experience. So just again, some of this will be very familiar to the kind of strategic choices that we have for pandemic responses, that typology, what elimination consists of, and Ian's covered this, the impact, and some of the key questions and conclusions and lessons for the future. So we all know when you're assessing pandemics, there's information that you have quite early on about transmissibility and severity, inequalities, and a whole lot of things you really want to know at the beginning that you don't always have. And I've kind of highlighted these in red. And some of these things we will only know in hindsight, probably the net economic impact, for example. So just again, reminding you that because to justify this huge effort, we obviously have to speculate early on about the various scenarios that may occur if there's uncontrolled transmission, for example. And so with my colleague Nick Wilson, who really led this work, we came up with, we think is what was probably still a very plausible estimate back in February last year of the likely impact of the pandemic in New Zealand based on certain assumptions. So it is about, it's not quite of the scale of the 1918 influenza pandemic, which is, I guess, a global benchmark, but it is certainly in that range, about 0.3% of the population dying. It's equivalent of 25 seasonal influenza seasons. I think we're all aware of the consequences. But one of the factors in New Zealand that was a very powerful motivation was a concern about inequalities. And this is showing a century of contact or experiences with influenza pandemics, and looking really at the rate ratio of mortality for Maori compared with European other. And even though that differential has dropped, even as recently as 2009, Maori was still significantly more likely to die in a pandemic situation. So equity was a big driver in New Zealand. So like many of you, I'm sure, when something of this scale occurs, you often remember when you first became aware of it and when you first absorbed the idea this was a really serious threat. And I know that sitting in New Zealand, and I think for many people, it was quite clear during January and certainly by the end of January, this was going to be a global pandemic. And obviously that was very depressing. But for me, the most important single event, I think, was seeing the report of the joint WHO-China mission, which confirmed that Wuhan really had contained this pandemic. And that convinced me that elimination then was possible and probably the preferred approach. The other realization was that by the time the virus was starting to transition from imported cases to local transmission, the realization New Zealand was not ready. We didn't have the infrastructure, and so that we needed an intense lockdown. One of the things that has surprised me throughout is that WHO in particular, although it was obviously very closely engaged with China and observed the experience of Wuhan in basically eliminating transmission, which was a phenomenal achievement, have really not pursued this focus on elimination since then. I mean, this is the very basic fork in the road, if you like, which applies to infectious disease control. And we obviously try and control most infectious diseases. And we've seen this split really between mitigation and suppression approaches in terms of our response across the globe. But elimination is a very well-established model, and many countries, most in fact, high-income countries at least, are pursuing or even achieving measles and rubella elimination. But eradication is obviously a much tougher goal and very rarely achieved, but is certainly in this typology. So as Ian's mentioned, this typology can be looked at a different way. And I guess the dotted line here is to say that exclusion elimination strategies have an exit path, which is obviously very attractive. And we saw early in the pandemic that this was achievable in countries like Taiwan and mainland China. So again, as Ian noted, and I think many of us are aware, across the globe, after 20 plus years of working on this, pretty much every country had a well-established pandemic influenza plan, which focused on mitigation and flattening the peak. And we, in February, March, developed really the idea that elimination strategy was very appropriate for this pandemic threat. We assumed that this would be just a global movement in this direction because the evidence seemed so compelling to do this. I'm still quite surprised that we are, I think, one of the few countries that has a published elimination strategy. And the really remarkable thing was that our government committed to this strategy really on the 23rd of March, when it said it would pursue a rapid lockdown with only about 100 cases and no deaths. So that showed an amazing, I think, vision and commitment on their part. So again, just back to the basic, what's in the elimination strategy. In the end, we all are familiar with this, the pushing the reproduction number down and realizing that you've just got these very limited tools of reducing transmissibility, contact rates, and duration. And you've got, I think, almost a medieval tools until the arrival of vaccination, of course, for actually reducing the reproduction number. And so, again, looking at the components of elimination strategy, keeping it out, exclusion of cases is critical. Case and outbreak management, obviously focused on cases, testing, contact tracing, and so on. And then preventing community transmission. And at the moment, of course, we don't have vaccination in New Zealand. We had to use these basic methods of reducing transmission per contact or contacts. So again, these very simple measures. And another element, of course, is the social safety net, because we have to support groups who are really adversely affected by the elimination strategy itself. So looking at these components, there are so many remarkable things that happened that seemed almost inconceivable before this. And that this was the intense border management that you have to have with elimination, showing a 99% reduction in arrivals, and departures are very similar. And in fact, there were some days when no one came or left from New Zealand. And that had everyone looking through the record books to see when that had last occurred in New Zealand, and it was decades ago. So obviously, if you have testing, contact tracing, you need to build up this capacity very rapidly for high levels of testing. And there's some peak periods here of up to 25,000 tests a day during an outbreak in Auckland in August. So hygiene measures, the traditional approaches are obviously sensible, stay at home if sick in particular, wash your hands and respiratory hygiene. But as we quickly learned, of course, these measures do not work very well on a respiratory infection where a lot of the source cases are asymptomatic and it's spread by respiratory droplets and aerosols in indoor environments. And this is really where mass masking came into play. For my efforts in promoting mass masking, I am now enshrined on one bit of packaging for one form of mask sold at the National Museum. So Ian's mentioned the alert level system, which I think was a brilliant piece of risk communication. I think the whole country now understands these levels. I think they can almost recite them. And behind the scenes, of course, there are many, many pages to explain what these levels mean for every activity in New Zealand. So one of the things that happened is New Zealand did a very intense lockdown. And you know, as I'm sure many of you have looked up the Oxford Stringency Index, which you can generate these graphs in just a few minutes. But one of the things that's interesting is New Zealand had 5 weeks at this intense lockdown, and then 2 weeks at level 3, a less intense lockdown. And since then, apart from when we had an outbreak, we've maintained a low level of lockdowns, as opposed to many other countries. And it always seemed remarkable to me that there was a faction in New Zealand that said we should emulate Sweden, that we had this focus on lockdowns. Actually, this is one of the great benefits of pursuing elimination, is that you need to use lockdowns much less. So there are these amazing images. This is the rush hour in the main highway going into Wellington in the middle of this intense lockdown. So I won't say much about the safety net, but this was a huge focus of the government to protect vulnerable populations. And we're always concerned about unintended consequences, the direct effect of the intervention and the indirect effects from the recession. So there are all of these elements that need to be considered. So the impact of the elimination strategy, there's several publications now about this. This is one we published quite rapidly in the New England Journal of Medicine, just summarizing the phasing in of interventions and this decline from what would have been an exponential curve where we are transitioning from imported cases to local transmission. Basically, this was extinguished by effectively putting the whole country into home quarantine for 7 weeks. Again, you've seen some imagery of the genotyping, which has been an amazing tool. And this showed really that New Zealand imported the virus from all over the globe, a huge range of lineages. But interestingly, only about 1 in 5 of these cases transmitted the virus beyond one additional case. It shows how lumpy the transmission of this virus is. So I think there's some key questions here, and I'm just aware of time, but these are some of the questions that have come up about the elimination strategy, and I'll just run through these quickly, because I think some of them are relevant to, I think, the wider discussion about generalizability of this strategy to other places. So quite clearly, eliminating COVID-19 is a very good way of reducing mortality. New Zealand's has the lowest COVID-19 mortality in the OECD. It's not, and it's by a huge margin, of course. It's by about 100-fold less than the OECD average. And of course, these numbers are continuing to go up. Does it protect the economy? Yes, and we have included this initial analysis in this B&J paper, but basically, and it's a very busy slide, this does show how that not only do you have much less lower mortality in countries pursuing elimination, but also there's less economic contraction, and in fact, China has net economic growth based on GDP in 2020, and these are IMF estimates, and Taiwan is probably going to be maybe slightly in the positives, and the New Zealand estimate is actually going to be less than this when it's revised. So you're not sacrificing your economy, it's people and the economy go together. And I think, I'm sure all of us are saying the same message, but I think the evidence is there now. So an element of sustainability, it is sustainable. This was always a fear in New Zealand that we would get border breaches, and we've had a number of these. These are these red marks here where you get local transmission, but these would be hard to contain. And in fact, I think because our contact tracing has been built up during this period, it had the capacity to manage these events. And I think it's a huge tribute to the public health sector in New Zealand. So resurgence planning, this is, as I'm saying, involves a lot of contact tracing. We have the ability to raise the alert levels, and that was done in the Auckland August cluster. And we have not really relied on mass masking particularly, but it's now at least an option that's being promoted more actively. So is it generalizable to diverse jurisdictions? Well, there are a number of countries that are pursuing this to a high degree. It's sometimes hard at a distance to know exactly what's happening in some countries and the quality of their surveillance, but looking at the reported data, these seem to be countries that are clearly achieving it, or at least aspiring to it, and having low, apparently low incidence of COVID-19 and mortality. So this is a really a case study about its generalizability. I think there's the Wuhan experience, but that may not be so generalizable to liberal democracies. But here we can see in Victoria, Australia, they actually had a very intense resurgence where they had rates that were markedly higher than the UK for many weeks. And they actually used a very targeted lockdown to basically stamp out this infection and achieved return to elimination. Actually, they had never totally achieved it, but they did achieve elimination and are sustaining that. So I think this is probably one of the best case studies of the fact that it is generalizable, this approach. it is also generalizable to other potential pandemic diseases. And I think this has been demonstrated in New Zealand and a number of other countries pursuing elimination. This was our influenza epidemic curve over last winter compared with previous years. So that is good news that this method can also be used on pandemic influenza, which has a lower reproduction number than COVID-19. So I think that's a great lesson for the future. And one other thing in New Zealand, we eliminated our excess winter mortality, and all-cause mortality has actually declined by 5% in New Zealand. So basically, at the end of last year, we'd estimate that we had saved 5,000 lives if we had compared with what would have happened if we'd had the OECD average mortality. We also saved perhaps 2,000 lives through people who didn't die through excess winter mortality, which is driven by respiratory infections. So that's around 7,000 lives, which for our population is quite a significant number. Can it be done better? We've published a detailed comparison of New Zealand and Taiwan, and I think Taiwan really has achieved remarkable success based on a whole lot of indicators of very low, very good control of local transmission, and very little or no lockdown needed and sustained elimination. So we've really distilled what we think are the key lessons there for ourselves, and hopefully other countries can look at this. So the other thing we think is a long-term lesson is moving away from pandemic plans that are based on a single pathogen and to an all hazards approach. And this is our thinking around what that might look like, and this will be freely available online shortly. So the big conclusions we have from this, and these are largely covered in this BMJ paper, that we think the evidence is very, very compelling that elimination is preferable to mitigation and suppression. We think it can be achieved and sustained in very diverse jurisdictions. And we'd say that probably it's the preferred response to any new emerging infectious disease where it has pandemic potential and where it has moderate to high severity, where while you're waiting to estimate key parameters, so I guess this is the precautionary principle, and hopefully the World Health Organization will, I mean, I think there's a lot of things they have to absorb from this event. And again, our conclusions are that elimination is favored by certain conditions, and this is really a subjective assessment, but it's partly based on our own experience, that these are really critical preconditions for elimination to be adopted and to be successful. And once again, I think just to reiterate, effective science and good political leadership. It seems to be no accident that many of the countries that have done well or performed well with this pandemic have female heads of state. We know association is not causality, but I'm quite convinced. And again, I think the silver lining has to be that this is the great case study and the lesson globally about the need for a broad reset to focus on these global health threats. Certainly in New Zealand, green recovery has huge support. I think it's probably a global movement, and equity is also at the core, I think, of an effective response. And I think that would be one of the other elements that's been emphasized time and time again in New Zealand. So to summarize, science and leadership, I think the evidence is in. Elimination achieves better results by every indicator. It's an opportunity to strengthen public health and also this major reset. And again, huge thank you to my many colleagues, and again, wonderful, at times, interesting relationship with our health agencies and our politicians, but it actually has been really wonderful experience working across all of these groups. And just a reminder that New Zealand is a bit of a village. It does give us an advantage. We can pick up the phone and talk to people, and that's been hugely helpful. Thank you.
Thank you, Michael. One is amazingly impressed by how reasonable the actions in New Zealand have been. And of course, that would have been a very good story to tell as something that had been adopted more widely. I can tell you that a year ago, I was hoping that the same kind of actions would be adopted everywhere. Obviously, they have not, and we still have a tremendous amount of effort to do in order to get there. Shall we take some questions? Please, we have a couple of minutes for questions. So I guess this is the question. Any suggestions for countries who have high cases now? Can strict lockdown now get us to COVID zero, zero COVID?
Suggestions for progressing.
Yeah, suggestions for countries that are now in dire status. What would you recommend?
Well, I think the essence of elimination approach is this idea of a single-minded proposition that actually, and I think it's been articulated, I think, by several of the speakers from Ireland and others, that having that focus works. That one of the huge weaknesses of the suppression approach is that no one knows what that actually means in reality. I mean, how many cases can you live with? And it's extremely hard, it seems, to coexist with this virus. Whereas I think committing to zero COVID with, and obviously vaccines are going to help. We don't know if they interrupt transmission, but they're very likely to have an impact on that. We're extremely well placed. I mean, any high income country can do this, but I think it's having that single-minded proposition accepted. If you don't have that accepted, I think there are problems.
And I'm going to ask a leading question. What can we do globally to help bring the information from New Zealand, Australia, Taiwan, Vietnam, and so on to the countries that have, for multiple reasons, and continue to pursue the ineffective suppression mitigation strategies?
Well, you'd think this would be a role for the World Health Organization. And I don't know how many of you work closely with WHO, like I do occasionally work for them, but at the core, they have not led this paradigm shift. And I think I find it very frustrating. Yeah. So I'm sure collectively there are people in this call who are on this meeting who can raise this with them. I do find it remarkable that this is a strategy that's protecting a sizable portion of the world's population, and yet elimination does not feature in any of their communication that I'm aware of. So they have the mandate to do this. So that I think would be a really critical advance in thinking.
Thank you. Is there any other questions? There are a couple of comments here about having a global health summit. And indeed, this summit is not domestic. It is intended to be global, as is evidenced by the participants and the speakers. But surely there is opportunity to do more and more of this communication. There's another question about the difference between physical distancing and social distancing. Would you care to answer how you think about those two terms?
Yes, I mean, this is an attempt to re-engineer language, and quite deliberately, because we want people to be socially connected, but physically distanced. And the term social distancing always seemed, it has some negative connotations. So it may be a losing battle because social distancing is so entrenched in the literature. They are synonyms, but it's intended to convey a different flavor. And I think it's partly the view that language matters. I don't know if we'll succeed. It's just like quarantine and isolation. Those terms are used very differently, almost interchangeably, even though they've got decades, I don't know, even a century or more of very specific usage. So as an epidemiologist, I get very frustrated that they are used. New Zealand, for some reason, is using them in almost reverse order. So reverse meaning, I don't know why, it's a bit of an accident. Yes.
So we have extra time. We have about 20 minutes for additional questions or conversation. And from our previous session, I see Tomás is still on, and I don't know if he would like to turn on his screen, and maybe you have questions for each other that you would like to pose. I think I'm sure that people would enjoy that opportunity for hearing your dialogue. And others who would like to ask questions and participate in the conversation, I think this is a good opportunity to have that take place. While you are thinking about it, let me ask some question. You mentioned the interactions between New Zealand and Australia, and at the same time, and that was also mentioned by Ian Town, I think. Please elaborate just a little bit more about those interactions, and tell me which other countries, whether geographically proximate or not, have been, if you will, the most interactions. Have you, in fact, had interactions with either China or Taiwan or Vietnam or so on?
Yeah, well, certainly New Zealand and Australia have a huge amount of interaction with very similar cultural heritage and geographically close together. There's a huge number of New Zealanders living in Australia. And I think right throughout the whole pandemic, health officials in the ministry have talked at least daily, probably many times a day at different levels with Australia. So it does make sense that we shared approaches. But at one point, New Zealand departed from Australia, and that was on the 23rd of March, when we said, actually, we're going to go into this intense lockdown to eliminate the virus. In fact, the politicians were not comfortable using the elimination word because it seemed the bar was too high. They did talk about stamping out the virus and keeping it out. So again, language is sometimes quite important. And Australia didn't do that. It has a more conservative government at a federal level, and they preferred what they called aggressive suppression was the term they used. But some of the states were totally committed to elimination, and they pursued that. And some of them closed their borders to one another, a bit more like what you might see in a federal system overseas, like perhaps Canada or I don't know about the United States as an example, but in a federal system where, and I think Germany is actually an example where the main responsibilities are not at the federal level for health and health policy. So Australia, parts of Australia have kept the rigid border restrictions with the rest of Australia, and they're now opening up as Australian states are eliminating the virus. But I think by not committing to elimination, I think that created real problems for Australia. And I think that was an underlying cause of the big resurgence they had in Victoria, because they were tolerating low-level transmission until it became a large outbreak that couldn't be controlled easily. So the other interactions we have is with Pacific Islands, and I think particularly South Pacific Islands and Polynesia, and there's a large number of Polynesian people who've migrated from those islands to New Zealand, so we have very strong links. And we're now in the process of opening up travel corridors with, so far, just one of those island countries, but we hope to do more. And the other country, and this is just myself, I've talked a lot or worked a lot with the epidemiologists in Taiwan, because we were really interested in their great success and wanted to learn from that.
Very good. Who else has a question for Michael? So there's a question. Do you think the public's knowledge and understanding of their government's pandemic plan could help sway pressure for governments to adopt a better plan?
Yeah, it is always interesting how what aspects of the response require huge public support and which are more technical, because in many cases, some of the key responses are very much what we call more the health protection than health promotion. Managing borders, for instance, and implementing very intense lockdowns. These are quite tough measures that often governments have to decide on balance of evidence and needed. And then you obviously have to communicate that to the public. But it may be very hard to get public consensus around these measures. So I think it is a negotiation process and trying to engage the public. But particularly at borders, I think, which is a critical point, that is, I think, quite a major decision by governments they have to make. And they've got, I think, the mandate to do that. I don't know that the public are always on board about that before it's done.
So I have a question which may not be entirely comfortable. Your statement about the WHO, I think, is something that I can at least say myself, and many people here have been quite critical of WHO. My criticism of similar issues extends back multiple years to the Ebola outbreaks. But in this context, there's been a professional failure in relation to your quite reasonable statements. When you put up your presentation and you say elimination is a choice, and it's a well-established epidemiological choice, that's not the message that is being heard in multiple places in the world from the epidemiologists and public health experts. Where did that get lost? How did that happen?
I guess that will be one of the great questions that's analysed for many years to come, because I'm actually, just in the elimination case, for example, I'm on the WHO Regional Verification Commission for Measles and Rubella Elimination. And so we meet across different parts of Asia every year to review progress. So this is a WHO-sponsored process. So they have plans for eliminating a number of diseases. So it's absolutely a core concept that they promote. So somehow this concept, this paradigm was not applied to this virus. And I think a lot of it is about the huge momentum that pandemic influenza planning has had. It's dominated the thinking, and modelers in many countries appear to have also perpetuated that. And I mean, I've talked to colleagues, and particularly, I mean, we normally look to leadership because New Zealand's got a very small science capacity. So when we see a pandemic, we immediately look to the World Health Organization, the US CDC, Public Health England, European Centers for Disease Control. We're looking at all of the documents they're producing, and they did not emphasize the threat very early, and they certainly did not talk about elimination strategies. So we, I think the last possible moment, we are looking at Asia and saying, those models are working there, that's what we should do.
So there's another question, to what extent were big business, vested interests, political donors, etc., pressuring New Zealand government to stay open, or were they largely on board early?
Well, this is one of the remarkable aspects of the New Zealand story. The other group that was lobbying our politicians were our business leaders, not what I'd say is small business. These were the international, very wealthy business elite who said, basically, and I think it was a bit of a lifeboat New Zealand framing, they could see what was happening globally, and they said, look, you've got to take this seriously, take extreme measures to protect the New Zealand society and also New Zealand economy. So they could see this, and also I think were quite visionary. And I think it's the only time in my life when I was jointly talking with the Prime Minister and Finance Minister with the business leaders saying the same thing. It was remarkable. I'm not sure if that will ever happen again.
There's another question about back to the WHO. Why do you think they have been slow to acknowledge and address the evidence of the central fact that COVID is airborne?
Yeah, I think that they have done the same with mass masking. They were very late to say this was a useful strategy. I don't know. I mean, there's, I think Helen Clark, for instance, as you know, is jointly leading a review group. They've put out their second preliminary report, and they're going to report finally in a few months' time. And it was very critical of the World Health Organization and China for the slowness of their responses at key moments when this pandemic was manageable with decisive action. And I don't think they're going to be, I think they're going to be very direct, which is good. So it may identify that there's some core issues. And I think one of them we have to say, of course, is that the World Health Organization has been hugely underfunded and under-resourced to do its job. And I think that's pretty evident during the response. And I think that extends to their ability to assess and look at evidence. The other thing is they're a membership-based organization, so their normal decision-making processes try to get a lot of engagement and consensus from member organizations and member states. And I think that can be very slow in an emergency response.
Yes, I think I would affirm that the fact that they're members of other countries creates a somewhat maybe a conflict in terms of their ability to provide guidance, maybe. I don't know. But let's talk about one other detail, which seems not so important, but when the WHO report came out about China, they used the term non-pharmaceutical interventions. That's not the terms you use. Would you care to talk about that?
Excuse me.
Okay.
I think the term non-pharmaceutical interventions is a standard term used for, it covers all the things that you do in the early stages when you don't have vaccines or antivirals. We do use that term as well. Some people say it's better to talk about public health measures, but no, I think that's just different terminologies for the same thing. So okay. Managing orders, quarantine, isolation, contact tracing, and so on.
The reason why I question it is that it seems to say that the center is the pharmaceutical interventions, which I might wonder why that would be the order of priority under the circumstance. That's something that I have wondered about. Okay. Is there anybody else who has a particular question? We're coming toward the end. And I think we've had good questions. I think the others are more comments than questions. So maybe we'll turn it back to you, Michael. Do you have anything else you feel that we should hear about? You gave a presentation, which was a prepared presentation, but maybe you have some additional thoughts to share.
Well, for me, the fundamental driver of change is to identify that zero COVID is a far better goal than the alternatives. We sometimes say the least bad choice, because whatever you put forward involves huge more than inconvenience, actually suffering for some people. one of the things is I always think is the prevention paradox. I don't know if paradox is exactly the right term, but this is the idea that when you, in public health, if you intervene effectively, nothing happens. No one dies, and there's less disruption to economies. And so people after a while feel, well, we don't need to invest in that anymore, because the people who are saved from dying or don't suffer long-term consequences are invisible. And so they're not an advocacy group for action. But if you talk about all the things you have to do with elimination, that hurts people directly. It hurts their livelihoods, their businesses. And some people will probably die or be injured as a result of some of these measures, because they are involved massive disruption, telling the whole population go home for 7 weeks. That has definitely hurt people. But on balance, the benefits are much greater, but you have to use modeling and you have to use persuasion to identify those benefits. And meanwhile, you've got the clamor of people saying, no, don't shut the borders, you're wrecking our livelihood and everything. So I think this is the prevention paradox writ large in terms of the barriers to actually doing the right thing. And that again is one of the lessons that I take from this episode. In New Zealand, we had to, I think we had a compassionate government who was also smart, and they could see that there were net benefits in pursuing this approach. So I think now, of course, almost a year on, the evidence is so compelling that we don't have to use modeling anymore. We can use case studies. We only have to look at China. I mean, they are emerging from this in very good shape, both from relatively low health impact, certainly amongst the lowest COVID-19 mortality rates in the world, and with the economy thriving and many people returning to the new normal very effectively. And may be able to sustain this with a very long, complex land border, a huge population, densely populated cities. So I think the evidence is there now. We don't have to just produce a hypothesis that this will be beneficial. It's there, and I think we all need to act on that. So thanks for the opportunity to talk with you all.
Thank you. And once again, it's so amazing to hear both from Ian and your presentation that a system can work, that there can be government leaders that take it seriously, that there are scientists that are available to inform them, that have the right framework of information, and that the collaboration can result in safety and well-being for the population. And now we have to figure out how to translate that to other places in the world. And the example that you've given us is super important, because as you said, we have the case studies. And while you just pointed to China, surely the case study in New Zealand has been an incredible thing to aspire to as we engage in this challenge globally. Thank you very much. I think we all appreciate, again, a round of applause would be very appropriate, and we will do so in our limited virtual way. Thank you so much, Michael, for joining us in this program.
Thanks, Yaneer.
We have a break now for about 10 minutes, and then the next program will start. There are presentations next, including on airborne transmission and schools and other presentations starting in 10 minutes. Wherever you are, it's still 10 minutes from now. Thank you very much. Take care.
Thank you.